Chronic diseases like diabetes, heart disease, and obesity now affect over 60% of adults globally, despite medical advancements. In the US, these conditions account for 87% of deaths and $1 trillion in annual healthcare costs. Hospitals overflow with patients dependent on medications, yet symptoms persist. This crisis isn't about lack of treatment, it's about prevention. The answer may lie not in clinics, but in our kitchens. Doctors excel at treating acute conditions, but often prescribe pills or surgeries for chronic diseases without addressing root causes. For example, 80% of type 2 diabetes cases could be reversed through diet, yet medications remain the default. A patient's question, "Why am I not getting better?" reveals the gap in our healthcare system. Symptom management isn't cure. Since the 1970s, ultra-processed foods, loaded with sugar, refined carbs, and additives, have dominated diets. These products now comprise 60% of calories consumed in the US, directly linked to inflammation and metabolic dysfunction. Supermarket aisles brim with colorful packaging, but these conveniences come at a cost. A 300% increase in diabetes since 1980. Ancient cultures like the Mediterranean and Okinawan used diet to prevent disease, with staples like olive oil, seaweed, and fermented foods. Modern science confirms their anti-inflammatory benefits. Yet, 90% of Americans don't meet vegetable intake recommendations. Relearning traditional eating could slash chronic disease rates by half, as seen in blue zones. Chronic diseases often stem from deficiencies in fiber, antioxidants, and omega-3s. For instance, magnesium found in spinach and nuts regulates 300+ biochemical reactions. Deficiency is linked to hypertension and arrhythmias. Microscopically, inflamed cells from processed diets starkly contrast with those nourished by whole foods. Every bite rebuilds or damages your biology. Simple dietary shifts, like replacing cereal with avocado toast or soda with herbal tea, can lower inflammation markers in weeks. Homemade meals using garlic, turmeric, and cruciferous vegetables act like natural medicine. Studies show home-cooked diets reduce diabetes risk by 13%. Your kitchen, not the pharmacy, holds the tools for lifelong health. John, 68, reversed prediabetes in 6 months by swapping processed snacks for walnuts and berries. Maria lowered her blood pressure to 120/80 using magnesium-rich meals. These aren't outliers. Research proves 80% of heart disease cases are preventable through diet. Their fridges, once full of packaged foods, now overflow with seasonal produce. Junk food ads target seniors with low-fat or heart-healthy labels, while pharmaceutical companies profit from lifelong prescriptions. The U.S. spends $500 billion annually treating diet-related diseases, twice the military budget. Empowerment starts with rejecting this cycle. As one patient said, "I saved $200 a month on meds by cooking with lentils and kale." Start with 3 changes. 1. Replace vegetable oils with olive oil, linked to 30% lower heart disease risk. 2. Eat 30+ plant varieties weekly for gut diversity. 3. Avoid anything with ingredients you can't pronounce. Meal prepping saves time. Batch cook anti-inflammatory soups or roasted veggies. Small steps yield big results. Imagine a future where kitchens replace pill boxes. Communities growing gardens see diabetes rates drop by 40%. Your plate is your most powerful prescription. Foods like kimchi and almonds rebuild metabolism. Close your medicine cabinet, open your recipe book. As Hippocrates said, "Let food be thy medicine." The revolution begins at your table.